Hi, Katlego. Ke bone episode e nngwe dintse.
Are you serious?
Hey,
No, but it's nice because I guess every day you are learning. Yeah.
you know what inspired me to do this? Ela rola ke. I saw this at something similar at your office.
Yes, yes.
Anyway,
Nice.
today on our podcast we have Dr. Setlhare. Welcome.
Thank you so much.
Good
Good, but
how's business?
business is a little bit slow. It's winter. So it's a trend that I'm coming to sort of like pick up every winter. It gets a bit low, but it's fine.
In winter, people don't eat sweets or...
No, it's not about sweets. It's not about sweets. I just think winter, people sort of like hibernate. Yeah, so the business is a little bit slow. Yeah, but for me, it buys me time to do other things as well. I mean, there's always admin. I'm currently studying, so it's extra time for me to just do my own things as well.
Oh, that's what's
Yeah.
Hey, Dr. Setlhare is my family dentist. We owe her a visit. We must be due probably. We haven't received a call, so I personally haven't received a call. So
No, but you are overdue.
Yeah.
Every 6 months, I'm expecting to see my clients. Yeah.
Yes. Can you tell us how you met dentistry?
Wow. Look, when I was in high school, because I think that's when I was a bit mature and I could understand. We have our own family dentist who I still go to. Even now, she's still practicing. So there was one time when we were there and I was just intrigued by the terminology that was used, like referring to teeth with numbers. I was like, what is this world? So I think I'll say my curiosity from then onwards just grew. I finished high school, and when I had the opportunity to apply, I applied for that and I got in. That was just that. Yeah, simple as that.
What were your subjects looking like?
I had passed my Form 5 quite well. But look, apart from dentistry, I think I would have always just fell into the medical profession itself. Because just by virtue of my personality, I love helping people. I love people. I'm quite nurturing. So I remember my options. There was dentistry, there was medicine. I think the last one was agriculture. But I always knew I'll end up in the medical sphere anyhow, because that's what I love, actually. Yeah.
And you right?
No, I actually studied in South Africa. So after high school, I had to spend that following year just home. I didn't go to UB because my fellow classmates from Form 5 who went to UB went that next August, meaning now I was just home waiting for the sponsorship for that other year. So that's how I was just passing my year that year, just getting little piece jobs here and there. But the year went by so fast. So when I got to Cape Town, I had to do metric. That's like the requirement in South Africa. You have to do metric, which is, it's higher than Form 5. A little bit of a challenging year for me it was. I mean, I was like, am I even going to make it into varsity? But I made it, and I got accepted at the University of Limpopo now. Then it was called Medunsa. I got accepted there for my undergrad degree, dentistry. And that's just how the journey started.
Oh, so you start directly dentistry?
Yes.
You do like a general qualification, and then you later on get to specialize?
Well, no.
All right.
South Africa has dental schools.
Oh.
So you go straight into dental school. Yes. But of course, as the program starts, you are in the same class with your guys who are doing pharmacology, who are doing medicine from the foundation years. We only separated, I think, from third year, when now the medicine group was now focusing on that things. Dental was also now getting into that things as well. Exactly. But South Africa does have dental dedicated schools. So, yeah.
I get you. Besides being an actual dentist, what can one also be after qualifying with so many years of studying that thing?
Well, look, when you go into dentistry is because you want to see your patients and all of that. But there's also the academic part of qualifying as a dental practitioner, if I can say, because you can further do masters in so many things, even public. There's what we call public health. I think you've heard of public health. You can enter into that sphere where now our government and the Ministry of Health allows you to come and influence policies that obviously now govern how we do our things here in Botswana, if I can just use that example. So you can venture into the academic part of things. You can venture into research, which is still academic. I think also maybe because we don't have a dental school in Botswana, dentistry allows you, as you go into the academic part of things, to even lecture. Yes, I mean, I have colleagues who I finished with in South Africa who've never actually gone and started seeing patients. Straight from varsity, they already knew that path, like, I'm going academia. And they chose that route. And yeah, they're now, some of them have done their PhDs and they're now lecturing at good universities. Yeah, so that's the other side of dentistry, apart from being hands-on with the patients themselves.
So isn't there like a prerequisite that maybe you have to have so many years of practice first before you can pursue any other form?
Not necessarily.
Okay.
So with your basic degree, yes, you can start seeing patients. But because I'm going to just use the example of my colleagues in South Africa, after our basic degree, they just started doing masters. Right? And masters, they will go into research. They just totally diverted from clinical practice. They just go into research. Then after their masters, a lot of them will pursue their PhDs still. And then if they will be published in journals as they do their researches. But again, that way, I think it's a way of paving their route into now even starting to lecture the young undergrad students as well. Exactly. Yeah.
Oh, okay. So do you have like a national association of dentists?
Oh, yes. We do have a Botswana Dental Association here back home, which I'm a member of. And it just oversees dental practitioners in Botswana. It's still, it's not a young association, but it's because we are limited by numbers in Botswana, we are quite few. But it's growing. It's growing, exactly. Yeah, so.
That's right. I want us to talk about your journey after completing. So you knew outright, Hori, when you want to be deep in the trenches.
I love clients, as we call them, but I love my patients.
Yes.
So, and I think what was the beauty about me studying in South Africa, we had so much contact time with the communities around us. I don't know if you know Garangua, where the university is based. It's the outskirts of Pretoria.
Yes,
so
yes.
It's those areas where the community relied on the dental school to actually help it out. So those were our patients. So from early on, I had that interaction with patients. And that's just where my love also and the passion even grew bigger. So I didn't have to study, not see patients, and then only start to work, and then that's when I'm exposed to patients. I have had always that opportunity to deal with patients one-on-one from early on in my studies, actually.
Oh, that's great. Yeah, and then you came back to Bots.
Then I came home after my 5 years, And I applied and I was hired at Marina. Yes, one of our biggest referral hospitals here. And with Marina, it has what we call, it offers hospital dentistry. So hospital dentistry, the dental department is there, but it's also part of the main hospital as well. Exactly, where now the dentists are utilized by the hospital to also attend to patients. So when I was at Marina, I was going on call at night. We'll be called for anything that will be head and neck related. They will call me for such patients. Trauma patients, patients who would fight at bars and use bottles to, as weapons, would be there suturing them, So hospital dentistry was nice because it exposed you now to a different side of where now, comparing to my practice, is just a patient who comes, sits on my dental chair, and So with the hospital, it was very different because we are part of how the hospital was running. The reports from dental were incorporated in the reports of the main hospital. So the superintendent, ministering, he needs information also from our side for what's happening and all of that. So it was quite an exciting path as well of my life.
Hey, man, you're dealing with trauma patients. How was that, though, coming from a background, your dentistry?
From school. Look, it was fine. I think when, that those situations where, because you haven't experienced something, you sort of like say, I think I'm going to be scared. I've had to consult a gunshot wound patient. You can imagine how their face possibly was looking. This is someone who was trying to, and thank God they survived. They tried to take their own lives. But when you see such a case, you're like, okay, it's going to scare me. What am I going to do, But eventually you there's something that overcomes you and you're able to just deal with those situations. At varsity, we have, I think it was during second year, where we were doing anatomy. You get to dissect life-size bodies. And I had never been in a situation where I'm next to a dead body, but it was part of the course.
When about postmortem?
So we're just a group of 5 girls and we're given this dead body and the guy is like, okay, start. Where are your scalpels? Take it, cut there. And you're like, what is he saying? You understand? So I think naturally anyone will say, will I manage this? But then you manage. Like, it just starts to happen. Like right now, I've heard of people saying, so you mean your gloves can be bloody? I'm like, yeah. And then when I'm done with the procedure, I go and have my lunch. It's just part of what the package brings. So I'm fine now. But I had my moments where I was like, am I sure I want to go into this territory? Like, we were given a bag of bones when we were doing anatomy. I would just sleep with those skulls around my bed. I sleep at night late in the morning when I'm studying. So there was one time when I think it was a friend of mine. She came in and then she just found this skull on my bed.
Wait, so you could leave with those?
Yeah. You just take them home because it's like homework. But so they give you a bag of bones.
That takes the homework to a whole different meaning.
I'm telling you. So that was my homework. So you have that bag and you are accountable for all those bones, by the way. So, I'll be having my sandwich, but I'm holding something because you need to learn all these things. So, look, it was a new world for me, but I also learned that with anything new, you are able to also just grow and adapt. So I didn't get so scared where I was like, I don't think I can do this, So that is why even now, nothing scares me in terms of just medicine or medically related anything, because I've seen a lot of things. Exactly, yeah.
Yeah, man, that was quite interesting. But what about you being an African? You know, we have certain beliefs and practices. I mean, don't you ever find yourself honestly those parts where you're like,
No. But do I meet people maybe who come with different types of thinking?
yes, no, definitely.
I do. And this is where sometimes you can see there's that gap where you are like, how am I going to make them understand this? Or no one did anything to you. You know, I think it will be like a cyst.
Yes.
So you'll be like trying to explain to this person, okay, this is what could have happened and that's why you have this. That's why I'm swollen like this, you understand? So yes, you do come across those. So you come across those situations, but this is where you also have to sometimes be human, even though yes, the science is influencing you. Because when an old man comes and they say that, you know, that's the old man that later on you'll find his bed empty because he just thinks no one wants to listen to me, and he will be gone and bad things will happen. So sometimes this is where you have to just be understanding and say, okay, so that's just how sometimes you navigate those beliefs. Yeah.
Yeah, so back to Marina. What then happened after that?
Then I was at Marina for many years. I think almost 10. Yeah, I was at Marina for almost 10 years. But it was a very, those 10 years when you're at Marina, it's a lot of experience. Because everything gets thrown at you. I get it. Especially like I was describing the whole hospital dentistry, how it's very different from practice now in the private sector. So it was many years of experience. I've had the opportunity to work with very good surgeons. Like your surgical skills get sharpened because then the guy will be like, no, just go attend that, and you grow with it. But for me, I had always had that dream to say, you know what, eventually I should just have my own thing, because I also had my own dreams, right, of how I would want to grow in the profession. And I think there was a time when I realized that, you know what, Marina is not meeting me there. So maybe this is time when I can now spread my wings and go start my own thing and realize those dreams. So that's how then the private practice came. But after 10 years in Marina. Yeah.
Were you afraid of jumping?
Of course.
From the cliff?
Look, I was, because it was an unknown territory, you know. When you want to start a clinic, for me, I was just like, I want to start a clinic because I want to see patients. But the minute I jumped into that other side of the world, then you realize, this is not just seeing patients. I'm running a business here.
Yeah.
And I had no clue.
Yeah.
Because now that comes with admin responsibilities.
You have accountant?
I'm the accountant. This is not adding up, but your staff is looking up to you. So I'm also managing people, something totally new. So it was a bit scary. And I mean, there were times when I was like, am I sure? Or should I apply back and ask for my job back at Marina?
Oh, yeah.
No, like I had those moments, and I think it was okay for me to also have that bit of self-doubt. Not like I didn't know I could do it, but it was challenging. It was totally new. I mean, when you are working for government, it does the rest of everything for you, by the way. When you just wake up and go to work. I was paying rent, I'm paying salaries, having to equip the practice itself, finding guys who can maintain the stuff. So it was like a whole lot. But it was also exciting because look, it got me out of my comfort zone. So it's growth that made me uncomfortable, but I allowed it because I was like, otherwise, Kat, you can go sit for another 10 years in Marina, and then are you going to be happy? Because you have these other dreams that you want to achieve, and only private can do that for you. Exactly. Yeah.
Smiles for Miles. First of all, beautiful name, by the way.
Yeah.
That was quite a thoughtful name, you know. It's in Repudameno dental practice.
No.
Yeah.
Yeah.
Hectic. You know,
Yeah.
Smiles for Miles. It's got a deft touch to it. You know what? Okay, these guys are talking about smiles. What exactly was your vision that you had for this particular step in your journey?
So look, I mean, just from the name itself, I'm very creative, naturally, and when I thought of a name for my clinic, I was like, look, I need to find something that also just resonates with my personality.
That's what's up.
And I smile, I think 80%, 99%.
Yeah.
I'm always just smiling. I love that. But when I came up with that name, I was like, okay, Smiles for Miles Dental Practice. What is it that I want to do differently? And I was like, you know what? I just want to have clients who come here and they're just happy. And they smile and, you know, they look forward to coming to this place. That's why even when I was putting the place together, my attention to detail, I was like, I just want a beautiful place. And also, I wanted to demystify the whole thing of, you know, dentistry is painful. So I wanted to create a beautiful environment for my clients. So I hope that didn't disappoint. I mean, you've been there.
Yeah, I've been there.
Yes. But the main thing also behind Smiles, like I was saying, I've always had a dream of having a practice, but I also had always wanted to gravitate my services towards kids.
Yes. That was
Yes.
actually my next question.
Oh, was it?
Yes.
Okay. Yeah. So I had always wanted to gravitate towards that. So I also was looking just for a nice, happy name that, you know, when a child is also thinking of, they are looking forward to coming there. Yeah.
Yeah. Why kids?
Why kids? Wow.
You have that very colorful consultation room that my little boy likes a lot.
Yeah.
Yeah, and it's nice and colorful. And every time I'm in there with him, he, you know, contrary to popular belief, you know, you'd think that kids would be quite something to deal with when it's time to visit the dentist. He actually looks forward to it. And then in that reception area, you guys have that little PlayStation.
Yeah.
Coloring, and you know, those little toys there. So I can see where there was a lot of effort in you trying to make it as comfortable as possible as it is for the kids. Now that you mentioned it, Hore, a big part of the idea was behind kids. Why kids? And yeah.
So apart from, I think I have a very childlike mannerism, especially when I'm around kids. I become like them. It's just me, how I am. But also, you know, when you have worked in a government setting and we know its limitations, you know, when a 4-year-old comes there and you need to help them, in that setting, you don't have the luxuries of, oh, no, we are going to sedate, we are going to go to theater. Sometimes it has to be done. And I think for me, when you see a child traumatized like that, it's not necessarily the nicest thing, but yes, we know we had to help that child. So for me, when I was venturing out, I was like, you know what? I'm going to create a clinic where a child can just be comfortable. Even when I'm doing the most of painful procedures, but I try to make it as comfortable as I can for that child. So I think for me, that is why I just gravitated towards that. It was just to bring dental to them, but let it be a happy experience. And I think that is where maybe I can say when I was still in the public sector, there wasn't that room, because also there you are working with time. At my practice, I can talk with a kid for 40 minutes. We reach an agreement. If they're not happy, we'll see you next time. I have room to do that. But you find that other environments didn't cater for that. Exactly. And also, when you come into the market, you have to do your survey as well. And I had always seen that, kids are not really catered for. They walk into a practice and it's just Dr. Batho standing there, and he's just like, okay, next, ready.
Sounds,
Do you
it's got
understand?
a good ring to it, Dr. Batho. Yeah, anyway.
Exactly. So I was like, look, let me create an environment where a parent, number one, will be relaxed, because kids feed off parents' anxiety. I mean, when a parent walks in, she's already anxious. How are they going to be assisted? But the minute they walk in and the environment is inviting, I think they relax, and the child actually relaxes as well. So, yeah.
You took the big leap. It's a very big leap. Sometimes I tell people, so you've never had formal employment your whole life. And I think, it's also a blessing in disguise, because I don't know what would have I been able to take that leap. Because with that leap comes the financial obligations that maybe I would have been tied to.
Exactly.
And definitely the things that you said, when you're starting something by yourself, you become the receptionist, you become the manager, you become the CEO, you become everything. And
Exactly.
then but back then, all you just had to do was to put your coat or body glove or bakai.
And when I started, I still had that type of thinking, where I just want to put on my gloves and say, where are the patients? And yet there was this whole marketing thing behind it. I was
Yes.
okay, now there's that. You understand? Nothing, they will come, but you need to work hard for it. So that's why I'm saying the things I started learning also. I'm proud of myself, because 6 years back, I didn't know anything about running a business. The admin, the accountant. Now he will be like, okay, it's time for BURS. We have to do our things. I never knew those things, but now I can say I know so much. And tell me tomorrow to open another business, I'll do it.
What can you say to somebody who's having the same anxiety you had 6 years ago?
Wow. And especially to a lot of my colleagues who are still just wishing they could hop over. Look, it's not easy, and no one can force you to do it. I always say, you will know when it's the right time. You will know. Because I know I hesitated, but something just told me, no, Kat, just go. You are not sure of what's going to happen, but if you are going to do the things you love, you are going to work the way you want to work. Just go for it. And that was it.
Okay.
That was it.
This is great. What does the future hold for Smiles? Smiles for Miles.
Yeah. Hey, Smiles for Miles. I definitely wanted to grow. And I wanted to grow. In 10 years' time, I think Smiles will be an exclusive pediatric dental clinic.
So not level
Ke tla bona hore ke go isa kae. That's where I want to grow the business. Exclusive pediatric dental clinic, in the sense that I would want to have my own in-house sedation theater. When you bring, it's like a one-stop thing for kids. Yes. So that's the future of the clinic, really. That's where I envision it in 10 years' time. And God willingly, it should become exactly that.
Amen to that. So, but what's sedation? Do you need to get training for that? Okay, and what?
Tota, it also depends at the level at which you want to take it. You know, like let's say now big hospitals, they have theaters where they can knock you out. Full. You are out. But you have modern day sedation
Is it
where
the general anesthetic?
Yes. But nowadays you can have what we call conscious sedation, where you'll just be drowsy, but you can hear me. Even when I say open your mouth, you can actually do that. But we have lessened your level of anxiety.
Okay.
Yeah. So those are the things that we aspire for. I mean, even adults sometimes when they come in for certain procedures, they wish we could just make them feel somehow. You understand?
We have someone who's to do
Exactly. And
high blood
exactly. And those phobias are there. But when adults come in, they will tell you, don't even tell me what you're going to do because I know what's going to happen. You understand? So those are the options that you can have to ease that, and then you do what you're supposed to do and help the client. Yeah.
There's a name for dingakatsa the braces.
Orthodontists. Yes.
Are they also dentists?
Yes. So the thing with dentistry, when you finish at varsity, I agree you have your main degree. But the beauty about the general dentistry degree is it exposes you to all the different fields of dentistry. So right now I'll say I'm a general dentist. But the nice thing is every day at my clinic, I'm able to do this, that. It doesn't limit you. But when you want to take it a level higher and you now specialize, right? Now there are other branches that you can get your specialty in. So the orthodontist now, he's specialized. He can never practice general dentistry. So whatever he sees that he can't do, well, not he can't do, he can do it, but they don't do it. He will refer that patient to me. Do you get it? Exactly. So if I refer a patient to him and I say this patient needs 1, 2, 3, and he assesses and he says, no, well and good, but I want 1, 2, 3 done. Minor surgery, remove a tooth there, they will refer that patient to me.
I got you.
They're the guys whose gloves never get bloody, by the way. They work in a nice, clean environment. They will send everything to me to do.
What else do they do besides body braces, and what other procedures that they?
Orthodontists.
Yeah.
Orthodontics is exactly that. It's a speciality of aligning our teeth in the jaw. So that's what they do. And usually it involves a multidisciplinary team where the orthodontist can send the patient for surgery. They can send them for place an implant there. But in the end, their responsibility is now to make sure everything is aligned with the jaw, the teeth, everything works. The aesthetics, exactly.
Are they the ones fashioning? Utsi menwala abasedi wa golale ana iriswe ke ba grandmothers ana khona go wa
dentures no that's, you see, it's another field of dentistry.
What happened to those things?
Where were they? But they did
you mo fashioning
but you know, you mentioned something like the future of dentistry. There are so many other things coming up that replace missing teeth.
Okay.
But yes, dentures are still the original.
My uncle can see I got my grandmother.
No, but they're still there. We still do. We still make dentures for patients who need dentures. Because there's a certain assessment you use. I mean, if I was to get an 85-year-old now, I'll use dentures for them. Implants. No, we wouldn't go that far.
Okay.
Exactly. But there are so many other options of tooth replacements nowadays. Yeah.
There's a very common netla ya ko transfer la maku transkolo thing.
Khating.
You had gold tooth.
O tla nkgamisa metsi batho. Eh.
Hey, can you just tell us about this thing and I had gold teeth?
So look, I think gold teeth, more so that I've studied in South Africa. There was a point where it was almost like a culture, to decorate your tooth somehow. I get it. Not that's where I really saw what is quite prevalent. It's in SA. In Botswana, we don't do that. I've never had a patient come to me and say, reduce my tooth and put gold. Do you understand?
Yeah, no, it was a thing.
I guess that's what I'm saying. I think a lot of these things are either cultural. It's like when you go to the Western Cape, you find those guys actually without teeth. And it seems like it was a culture movement or something. For them, it's okay, I guess. So that's why Kirit was saying, well, I think it becomes a culture and then it's a trend. But here back home, Tota Hela, I can see it's something that never picked up. But you would know someone works in Joburg. When they came home and they have that gold slit, you will know, okay, what are goes on who do you want to sell?
Yeah.
But Hela, me in our daily practices, no one does that here back home. Because for you to do that, you need to cut healthy tooth material.
To make way for the gold.
Exactly. And sometimes that's what people were going through. So, Mihela, no, we don't do that.
I see.
Yeah.
There was this thing when Rahola, where people who grew up more certain areas, I think because of the saltiness of the water there, they had these brown things to their teeth.
Yeah.
Yes.
I mean, we still see it. We still see it. We actually call that fluorosis. Chocolate.
Yes. Then
we call it fluorosis. And in Botswana, yes, there are areas, I think, research and even Batoba water, they know they have a high content of fluoride in the water. And I think the ones that I'm quite sure of, it's your Gwening region, Maung also, Kalahadi. So with that stain, it depends on how much excessive fluoride actually got embedded molino. Because babangwe stage, there will be a mild, moderate, and severe.
Okay.
Severe is that guy who will come with teeth almost as brown. That's when that fluoride is more the tooth makeup, if I may call it, right? And then mild, it's patchy white, but it's fine. Exactly. Yeah. So we do have that, and yes, with dentistry and the way it's advanced, we have ways of masking that as well and giving you nice, beautiful, white appearing teeth.
So it's depending on
the severity. Yeah. Exactly.
Okay.
Yeah. But it's something that I wouldn't want someone to sit at home and think nothing can ever be done. Yeah, we can actually definitely do something about it.
People to have that smiles for miles.
Of course. Yeah.
Oh, yes.
Yeah.
So what's the future looking like at dentistry? Malaysia, we hear about robots, we hear about AI, we hear about so many things.
3D printing,
yes.
Yeah,
there's a lot of research being done as well. So what does the future hold for you?
So, you know what, dentistry, like I was just elaborating earlier, it's such a vast field. It's literally advancing. I'll say every day there's something new, more dentistry. That is why it even forces us to continually just upgrade our skills as well. But the world of dentistry right now is everything is becoming digitalized. Like everything. Is it wanting to take an impression? You can do it digitally. Dira a crown, if you've ever heard of a crown. you have a machine that can immediately just cut that crown for you. I don't need to say, oh, but no, let me take an impression, then you come back next week. And I'm happy because I have colleagues who are doing that right now, like in their practice. Exactly. So it's an
3D printing teeth, Mobson.
I tell you.
Hey, man.
Literally, you just take that digital scan, like I was saying, you feed it into a machine that will now produce exactly that, and you can put it in the patient's mouth. So the world of dentistry is amazing. It's evolving at such a high rate, but it's also exciting things because it makes our work even more exciting, easier, convenience, So yeah, someone can come from Kasani. You see them by the end of the night when they take that last bus. You've sorted them out. Exactly. So that's where it's headed. And that's where we are. Yeah.
So are you also looking into maybe tapping into some of those?
Well, I need some of the things, definitely. It's just that everything, when it comes to dentistry, is expensive.
Oh, yes.
It's the expense. It's the money behind it. But look, when you invest in those things, it's worth it. It's worth it.
Definitely.
Yeah. I mean, your patients are going to appreciate now a procedure that would have taken 2 months. Now in a day you are able to assist them and they go back. Yeah. There's laser. I mean, it's a lot of things, Now you can do surgeries without a patient bleeding so much because you have machines that as you cut, they make sure the blood vessels are not bleeding. So it's making everyday practice quite enjoyable and less stressful, because that's the thing with dentistry. It's stressful. You work in such a small environment that how do you can feel I'm getting stressed here. Yeah.
We always hear about these doctor-patient ratios. We always hear about having worked in the public service, what can you personally say? I think we're all aware of some of the challenges that we have. What can you maybe give as advice to the people that are out there, if we could maybe look this direction for solutions?
Yeah. Look, when I was in government, definitely our government has a challenge when it comes to patient-doctor ratio. Government has a shortage of health professionals.
Definitely.
From nurses, I'll say really all varying fields. And there was a time when I heard government wanted to propose public-private partnerships.
Yeah, the triple P.
Exactly. And when I was in Marina, there was quite a lot of noise that was made about that. But over the years, it's become quiet, and I wish it's something they could resuscitate. Because if government was also to shift some of its workload to the private sector, I think Botswana would get quite bakatusiwa. You understand? Because now you find in the morning, let's say typically at a public dental clinic, you have 60 people lining up, right? And then I'm at my clinic, and for the day I've booked maybe 7 patients. Imagine if I could absorb the other 6. Another dentist takes the other 6. Because that 60, I can tell you, by end of the day, they won't be assisted. 12 of them are going back, maybe still in pain. You understand? So I wish it's something they could resuscitate, and we see how we can meet government halfway. And I wouldn't want to get into that, because I don't think we even have gotten to such levels where we've had to sit and talk and say, okay, as government, this is what I'm proposing. you as the private sector, where can you meet us? That's why I'm saying these are policies that we had just in the corridors. This is what government is thinking of. But I can't say if it's something that nothing has really come of it. And I know because we are already outside, the private dentists are willing to assist. I mean, already when it comes to, let's say, oral health month, which was just last month when we were commemorating World Oral Health Day, we usually like to become one with the ministry as well, right? So that we can see, okay, what is the ministry rolling out? Where can we assist? Exactly. So it's not like we're just these two, that one is running the show. We're really trying to have that collaboration with the ministry and hopefully something will come out of it. Yeah.
No, I think it's definitely a conversation to be had.
Definitely.
Because I think this is exactly what we're trying to bridge, the gap between what the one hand is trying to do and what the other people are doing on the other end. Oh, yeah.
Yeah.
I think as we wrap up our show, I'd like for you maybe to talk to a young student. O ka tswang a le ko moshaweng, maybe with
dreams and
dentist. What can you tell them? Or which subjects, if any, should they try to maximize on as they go through the junior and senior? And then maybe also just to give them a few tips about how really go at a university level now. I understand, some of us studied the social sciences.
Yeah.
And you guys are always in dust coats, hardly ever. It's not social life.
Of course. That 1 year, forget about it.
Yeah.
It's still the same even now.
Yeah.
But look, I think when I look at our curriculum in Botswana, I think I would like to challenge, and I don't know if career guidance subject or teachers are still there in our schools. So I think for me, I would want to challenge maybe heads of schools to utilize those people, because when you have a child who can communicate that dream now and say, I think I want to be a nurse, a doctor, a dentist, that career and guidance teacher should be able to identify them, should be able to see how they can get them to even go and actually see what happens in the actual field. Okay, this is the life of a doctor. Because I think sometimes when these kids have that realistic picture and they've experienced something, they have been at my practice for 2 days, it's something for them. Because for me to then say, ngwana o tshwanetse gore ba pasa science, batho ba pasa maths, when the drive is not there because they maybe haven't had that exposure, it becomes sometimes quite difficult. So I think from those grassroots levels, I think these kids need that exposure. Let's get them into programs, where kids don't just go home. Attach them. And I'm sure junior schools can do that. But when I'm open to having a young girl who just comes and says, okay, doc,
and shadow you.
And shadow me and see what we do.
Speaking of which,
yes,
actually we have another video platform that we are launching soon. A day in the life of.
Okay,
so
nice.
I think we'd like to now. Read what does Dr. Setlhare do from Mapakela up until Maitsibua.
Exactly.
Yeah. Because some of these things, it's all nice and like from the outside. You understand? But then how it's what hey. So the whole day, this lady is actually picking people's mouths.
I tell you. And I'm on my feet the whole day. We don't sit, guys.
Yeah.
Exactly. So that's why I'm saying, look, And of course, ngwana who has had exposure can have the drive to do well. I get. Any medical school, look, entrance, it's always you should have done well with your sciences. Fair enough. But I think, yes, the exposure will drive them to work hard and pass those sciences. I get. With UB, I know sometimes when they are accepted there, they have to do the BSc before they can go start the program. But like I'm saying, with South Africa, it's a different A. Because nowadays, I know kids actually do A-levels in Botswana. And then with those A-levels, they're able to apply directly to universities in South Africa.
Yes.
So back then, I didn't have that opportunity. I had to wait that gap year, then do the metric. Exactly. And yes, you get to varsity and you just work hard. That's it. Sleepless nights for 5 years. But eventually, if it's something that you love and you have the passion for, then you pull through.
Is it really that hectic, Ghana?
Yeah.
You guys are just over dramatizing it. Le dramatico is.
Look, it's hard work. It's hard work. It's nights of crying alone. So when I was doing my undergrad, and I have a friend, she's a pediatrician now.
Okay.
She's based in Orapa. Her name is Dr. Gail. So Dr. Gail, we would study together, and then she would go to her room. And as we part, because we still have so much work to do, I'll call her maybe midnight and I'll be crying. Like, am I going to finish studying for the time? And guess what? She'll be like, hey, just cry and then wipe your tears. And then we start studying again. So that's just how any student who's gone through medical school will tell you, you have those tough nights, but you toughen up and it has to be done. So it's exactly that, but we are not being dramatic. And we don't have a life as a medical student.
Okay.
You don't.
That is very interesting. Any plans of going back to study further?
I'm currently studying, and 2015 I also went back and studied. That's when I did my postgrad diploma in pediatrics.
Okay.
My clinic predominantly sees kids, so I did my pedodontics. That's just dentistry, more tailored to kids. And then currently I'm pursuing another postgrad diploma in orthodontics. What we were talking about earlier, the wires and the jaws and everything. So you know what? It's all part of self-growth as well. For me, it's important. But like I was also just mentioning that, with the ever-evolving field of dentistry, you don't want to be left behind. You need to always just develop yourself, whether it's short courses or that. But for me, it's also just my next step into growth in the field itself. So it's difficult, but yeah.
I think there's only one subject they can kiss them back to school. That's a master's in geopolitics.
Okay.
I have a huge passion for geopolitics. I can spend the whole day just reading and watching videos about the war in Syria, other, diplomatic things. But other than that, I don't see myself.
I mean, look, I won't be shocked if in 4 years you hear me saying I'm pursuing a master's in something. Yeah. It's good to learn. Knowledge is power. It's very true. Yeah.
So are you going to forever be a dentist, or are you open to other things?
Oh, of course. Yeah. Look, I think anyone really in life is blessed with so many talents, and you have dreams for other things as well. So me, apart from being just Dr. Kat at the practice, I'm a very creative person, like I was telling you. And I've deferred my interior design diploma. Hopefully to next year I'll finish it off. It's something that I had started, because it's that other side of me that I want to explore. I'm very creative. I love creating beautiful spaces, and I think it just complements who I am as well. I've always had a dream of having a coffee shop. So it's something that I'm not just going to let it slide. It's something I'm working on currently. So yeah.
Good luck with all of that.
The other sides of Dr. Cat, apart from just the clinic.
Thank you very much for honoring our invite to come and talk
Thank
to us
you so much.
about dentistry. I think we're today.